thank you to everyone who's joined us this evening. My condolences to the selection committee and to everyone at Mount Royal University on the passing of Paul. I know it would have been an honor to have met him, and really send my deep condolences to you on your loss. So, of course, I'm very grateful and honored to be alongside this incredible group of people previously awarded the Calgary Peace Prize. The recognition and the prize itself, however, belongs to everyone in this global access to medicine movement. And I want to personally thank the selection committee and Dr. Mark Ayash and Dr. Jennifer Patil at the Mount Royal University for this incredible honor, and with it, the acknowledgement of the fierce and committed global movement of activists that every day seek to put patients before profit. The Calgary Peace Prize will certainly elevate our voice and our work. And a special thanks must obviously go to the team at the HAI, Marlies, Younger and Althea, and to the formidable panel joining us this evening, Madhu and Siva, and Preeti, who unfortunately couldn't be with us. Now, a pandemic beset by hoarding of scientific knowledge and life-saving vaccines is wrong. And for this reason, on being awarded this prize, I have pledged to donate 100 Canadian dollars each to two organizations that are very close to my heart: the Health Justice Initiative and Gift of the Givers, a humanitarian organization in South Africa. I hope that those who are able to and can will match that pledge. I also want to preface my remarks this evening with an important note. There are currently rules that permit any government to take emergency measures in a public health pandemic like COVID, but they are not being used. This is what we call the TRIPS flexibilities. So the legal tools exist to remedy unequal access, but its use is being blocked by very, very powerful and vested interests with ties to large multinational pharmaceutical corporations. This is why the People's Vaccine Alliance and the Free the Vaccine campaign, which HAI is a member of, have throughout this pandemic called for three things: the sharing of knowledge, sharing publicly funded technology, and passing what's called the TRIPS waiver, which would be a temporary waiver of intellectual property rules to allow countries in the global south to scale up emergency production of vaccines, diagnostics, and therapeutics. Many of us have worked really hard for the last 2 years to warn about the consequences of IP strangleholds that create needless market monopolies and that fuel inequitable access to life-saving technologies. We do this work with limited resources and funding to show why hoarding is not an appropriate or just response, especially at a time when publicly funded tools exist to prevent human suffering. And where those tools are only available to a select few nations by choice, by design, in richer parts of the world, and not for the Black and brown people in my region, then let us just be frank and admit this is racism. And what we have seen is vaccine apartheid. Alarmist? No. See, I grew up under apartheid. And like many of the people on this call here this evening, we know firsthand what it is like to be a second or third or fourth class citizen. Like millions in my country, I know all too well what two-tier unequal systems create. They create inequality. We know what it means to be subjected to colonial extraction and exploitation or racism. And we also know what it means to be gaslighted. Yet here we are again. And to the contrary, we can detect variants ahead of others. We can set up manufacturing capacity. We can run clinical trials. Ultimately, we also want access to the best science has to offer, the fruits of scientific knowledge, at the same time as all of you in the global north. And just days ago, the UN Committee on the Elimination of Racial Discrimination issued a scathing statement on global vaccine inequity, saying that a pattern of unequal distribution within and between countries replicates slavery and colonial era racial hierarchies and deepens structural inequalities affecting vulnerable groups. My country in the late 1990s, just after democracy, initially tried to defend itself from gross multinational corporation pharmaceutical interests, succeeding only partially. And those interests combined with state-sponsored AIDS denialism created a perfect storm for preventable death and suffering. But you see, when people were getting sick and dying here in Africa from HIV and AIDS, we were told by the rich nations, by trade ambassadors, by the US government under President Clinton, by the pharmaceutical companies and its international industry representatives, that we can't use the measures necessary to get life-saving ARVs to people, while millions of our people died here in Africa, including my own friends and colleagues. So then, and now, in the last 2 years, pharmaceutical companies, their boards, their shareholders, CEOs have had unfettered, unelected access and power, the power to prioritize profits over patients in often uncompetitive ways. And that is not a slogan, it actually is true. This time, the EU is very firmly on the side of pharmaceutical companies too. And our former colonial masters in the EU and the UK are right now trying to bully us into submission, into agreeing to a very bad deal at the World Trade Organization. Quite early on in this pandemic, many of us cautioned that drug company benevolence or donations or charity is often a ruse and will not get us far, that we should never rely on the charity or donations or goodwill of rich nations and pharmaceutical companies because it doesn't create self-reliance, that rather we should seek enforceable guarantees. But then richer nations cleared the shelves, ordered up all the vaccines that were available and bypassed COVAX, an initiative which was set up to ensure equity in allocation for the whole world during this global pandemic. Médecins Sans Frontières has called COVAX a broken promise to the world, and the Lancet even referred to it as a beautiful idea that fell short. So instead, we now have non-enforceable, whimsical pledges from pharmaceutical CEOs. And here is the irony. The TRIPS flexibilities that I mentioned earlier that are contained in what's called the Doha Declaration were meant to remedy this. It's from the HIV/AIDS era, but spectacularly, the World Trade Organization and the member states have failed at even doing that. It's simply not fit for purpose any longer. We warn too that to avoid repeating the pitfalls of the HIV/AIDS crisis, governments and the World Trade Organization must make vaccines in this pandemic a public good by temporarily waiving intellectual property rights. But for 18 months, millions of deaths, millions of cases later, the World Trade Organization in a pandemic could not agree to the waiver, blocking it, despite 100 countries supporting the South African and Indian government's proposal with at least 65 co-sponsors. So if you want to observe power dynamics in a health pandemic, study the World Trade Organization. We are now presented with such a bad deal and bad text that we have had to say to our own governments, do not sign in our name. Even countries like Canada and New Zealand are still 2 years later sitting on the intellectual property fence. Canada, a longtime champion of patients over profit and affordable medicine prices, have had an about turn, and its neutrality suddenly on the IP waiver in this pandemic is simply bewildering. There is truly no global solidarity in this pandemic, a tragic repetition of the early years of the HIV/AIDS crisis. So quite early on in 2021, I wrote in Foreign Policy that given the lessons of AIDS, our COVID response should not have to rely on voluntary cooperation, but urgent wartime measures. Yet here we are at the mercy and beck and call of unelected private corporations and a very bullish European Union. And yet, compulsory licenses, we are told by the EU, suddenly are now the solution. But just recently, Pfizer in the Dominican Republic told our colleagues that a compulsory license on an essential treatment for COVID called Paxlovid would infringe on their human rights, a corporation's set of human rights. Canada is refusing to issue a compulsory license against Johnson & Johnson, requested quite early on in this pandemic by BioLease and the Bolivian government. And now, wait for it, Moderna wants a compulsory license from the US government for certain patents for a vaccine researched and developed by public funding while it is embroiled in a patent dispute with the US government. At the very same time, Moderna is refusing to cooperate and share the technology with what's called the WHO mRNA hub that has been set up in South Africa, likening the hub to a fake Louis Vuitton handbag. You honestly cannot make this up. So where are we now? New estimates just released from the World Health Organization show that the full death toll associated with the pandemic between January 2020 and December 2021 is approximately 14.9 million people that we know. The true death toll, based on modeling of excess deaths, according to Oxfam's recent analysis, is likely to be 4 times higher in lower income countries than in rich countries. So what is causing these deaths? Frankly, it's a free market, a profit-driven enterprise based on patent and intellectual property protections combined with a lack of political will. Although at least 11 billion safe and effective vaccines have been administered, nearly 70% of them have benefited high and upper middle income countries. We've warned about inadequate coverage in low income countries, and right now, in 2022, in May 2022, with multiple safe and effective vaccines available in the world, only 16% of people in low income countries have received at least 1 dose of a COVID-19 vaccine. In early 2021, it was a meager 0.1%. This means that within a year, we still have about 2.8 billion people who are unvaccinated. We have also argued that it is a myth to believe that high-income countries have been harder hit by the pandemic. Even so, they certainly do not deserve to have hoarded the lion's share of the vaccine supply for the world. Now, let me share with you how perverse 2021 really was for us. Did you know that the French president, President Macron, flew in a batch of supplies of Johnson & Johnson vaccines on his presidential plane when he visited South Africa in mid-2021, but for use by French nationals only, while South Africans were waiting for supplies from Johnson & Johnson? That the EU took millions and millions of J&J vaccines, filled and finished here in South Africa, and diverted them for Europeans, while we entered wave 3 without adequate supplies in mid-2021. Those exports were only paused when the New York Times exposed this, based on accounts by a whistleblower of what was included in the secret contract with Johnson & Johnson and the South African government. That Canada purchased enough doses to vaccinate its citizens 5 times over, and then also decided to draw supplies from COVAX. The net result by end 2021, according to the WHO, not even 10% of people in Africa were vaccinated, and by December 2021, 1 out of 4 healthcare workers in Africa were vaccinated. This is why even the WHO DG has called this morally grotesque, a recipe for seeding viral variants capable of escaping vaccines. So in my view, any policy decision to vaccinate everyone in the global north first, which is what happened, without prioritizing timely access for healthcare workers, the vulnerable, people with comorbidities, and the elderly in the global south, is frankly rooted in racism, because for them, Black and brown lives matter less. We have written in the British Medical Journal that this is a moral scandal, enabled by corporate and political permission of mass death, which is tantamount to a crime against humanity. Basically, patent monopolies are determining which populations will benefit first. Governments that were in the driver's seat negotiating with public institutions, using public funds with companies to accelerate very important vaccine research, turned a blind eye to the need for equitable access, resulting in what we call self-created vaccine scarcity. Even within countries in the global north, we risk whitewashing outcomes, where programs exclude Palestinians under occupation, asylum seekers, refugees, sex workers, migrants, Hispanic communities, African American communities, people in rural areas, and the elderly. And despite socializing the risk of vaccine development through initiatives such as Operation Warp Speed in the US, access was privatized. Colleagues that work with us estimate that the US government contributed for vaccine research approximately $1.7 billion for Moderna and at least $1 billion for Johnson & Johnson, with the US government also making advance guaranteed purchases for Pfizer for both its vaccines and its therapeutics. And in turn, as we predicted, pandemic gouging has taken place. So blockbuster profits rose, and Oxfam has stated that drug companies in 2021, wait for this, made $1,000 a second, creating at least 9 new vaccine billionaires. So instead of true and genuine tech transfer alongside the waiver, despite the injection of massive public funding, we have non-cooperation, a handful of fill and finish licenses and colonial container type models being shoved in our faces as just and timely solutions. It is anything but. Media reports indicate that even the staff at the WHO mRNA hub have found the mRNA intellectual property landscape a nightmare. Make no mistake, this is deliberate. The mRNA technology can be replicated faster, and the US government could use war measures to step in and share the technology as it holds its COVID summit this week. Instead, what Moderna has done has conveniently filed several very broad patents in South Africa that could threaten the work of the WHO mRNA hub. And despite their very evolving public pledge to not enforce patents, Moderna has refused to withdraw the patents here in South Africa. And that non-enforcement pledge only covers COVID-19 vaccines, threatening the hub's wider work on other health crises. So amidst the worst pandemic in 100 years, with massive devastation globally, instead of a freely available public good, COVID technologies largely remain a commodity owned by companies, first sold to the rich like a luxury handbag. And then there are donations. Donated surplus vaccines, at times close to expiry date, do not share knowledge. They are unpredictable, highly political, and discriminatory, and they are a vestige of colonial injustice. They do not address the systemic IP barriers. Simply put, they are not a just solution to a crisis of need. For 18 months, richer nations blocked the waiver proposal. And in recent weeks, civil society organizations, all of us here, have had to challenge a proposed negotiated settlement by the DG of the WTO, a text that represents such a bad deal that not signing it is better for the global south. And all of us are saying the text presented is a terrible and dangerous alternative. It is worse than the status quo. And we are relieved to hear that President Ramaphosa today said at the COVID summit that he would continue to advocate as a country for a full waiver at the World Trade Organization, not for half-baked solutions. And I've previously argued that the TRIPS waiver is at the heart of future medicine access battles and the role of the World Trade Organization. But the manner in which the World Trade Organization is currently operating for us is an obstacle to health justice. Because implicit in the opposition by richer nations to this particular waiver in this particular pandemic is an existential threat to the industry, to their continuing practice of treating medicines as a commodity, as if it is a Louis Vuitton handbag. So all of what I've now described is very pernicious and suggests a pattern of gross extraction. Some of my colleagues call it colonial extraction. But in summing up, I want to argue here this evening that there are 4 strands of extraction in this pandemic that require our attention, our research, our advocacy, and our challenge. And that is the extraction of knowledge that has happened in the pandemic, the extraction of excessive profit, the extraction of participation in clinical trials in the global south, and the extraction of contractual concessions. So first, life-saving medicine should not be commodified. I think we all agree on that. But publicly funded knowledge in this pandemic has been extracted for use and gain by highly profitable private drug companies without due recognition of the role of public scientists and government funding. Worse, knowledge sharing for the WHO mRNA hub that seeks to benefit the management not only of COVID, but of diseases such as TB and HIV in the global south is not being prioritized at all. In fact, the work of the hub is actively being undermined and sabotaged. Second, excessive profiteering in a pandemic is pandemic gouging, enabled by IP monopoly protection. Early in the pandemic, Pfizer announced an intention to profit from its COVID-19 vaccine. In the first 3 months of 2021, Pfizer's vaccine brought in $3.5 billion in revenue. By the end of 2021 alone, it made a shocking $37 billion and it aims to now bring in $100 billion by the end of 2022 for sales of its vaccine and a treatment for COVID called Paxlovid. Other companies are also making exceptional profits and are killing. Moderna, which received public funding to develop its vaccine and relied on the knowledge of public scientists that worked for the US government and at institutions that have worked on Ebola and HIV, earned $13 billion in pre-tax profits in 2021 alone. That amounts to $36 million a day with a 70% profit margin. It's simply unacceptable. J&J, with its single-dose vaccine, brought in $2.4 billion in 2021 just for that vaccine. Even AstraZeneca, with its so-called not-for-profit model, received billions in revenue, billions in public funding as well, and raised the price of its vaccine when it considered the pandemic to be over. Third, the participation in clinical trials of people in the global south is being extracted. I use the word extracted because there is no genuine post-trial affordable or equitable access as things stand. Africans in particular in the global south are being used as trial subjects with no guarantees of genuine benefit and data sharing. Let me explain. South Africa has taken part in 4 clinical trials for vaccine research, and now in 2022 is surprisingly running a 5th trial for a company called Moderna. Yet, in the natural resource space, extraction of gold or diamonds or other precious stones without benefit sharing is no longer deemed acceptable and is highly regulated. So why are diamonds and gold more important than people? Why are we permitting, as ethics committees, as regulators, as government agencies, as government departments, clinical trials in South Africa and the rest of the continent that do not guarantee post-trial affordable access for people in Africa, nor do they enable genuine trial data sharing either? Why are we helping companies perpetuate colonial extractionist practices and not insist on a minimum standard of benefit sharing? It cannot be the job always of civil society to fight for meaningful access after a trial has concluded. Fourthly, currently, nations in the global south, in Latin America, in Africa, are being bullied into signing contracts that do not follow key transparency or, in South Africa, constitutional principles. And we are being bullied by the pharmaceutical industry. Now, one principle of a democratic government is openness. But in this pandemic, companies have bullied sovereign states into secrecy and into signing non-disclosure agreements, thereby extracting concessions that countries would not ordinarily agree to, such as full indemnification against all forms of liability, pricing secrecy, and as we saw in the case of Johnson & Johnson and the EU and Aspen, unlimited export rights. So what we've had is akin to a hostage situation where accessing vaccine supplies on a limited basis, on a scared basis, on a drip feed basis is actually dependent on coerced acquiescence, fundamentally altering the principles of pricing transparency, of anti-competitive behavior, and open procurement. There's so much secrecy that the companies are refusing to even tell us as the HJI who and which officers sign the contracts, let alone what is in them. So now we have to sue for their disclosure. Finally, I just want to say that we are in an untenable situation that cannot continue. If we go along this extractionist trajectory that puts intellectual property and trade before health equity and access, then in the next pandemic, and there will be a next pandemic, we will be beholden to even greater forms of unregulated corporate greed and hoarding, enabled by very powerful and very rich nations who are in turn beholden to very influential and very wealthy pharmaceutical company CEOs.